My name is Helen Archibald and I'm a Managing Consultant and Psychologist at SHL, and I'll be your facilitator for today's session. For those of you who aren't familiar with SHL, we're a global leader in objective talent assessment. Each year we assess more than 35 million people in over 100 countries. In our session today, I'll be sharing some best practice guidance on competency-based interviewing to support you in conducting panel interviews for the Plastic and Reconstructive Surgical Education and Training Program. I'll cover the specific objectives of today's session in a little bit more detail shortly, but first some general housekeeping, and I'm sure we're all very comfortable with web-based sessions at this point, but as you may or may not have seen, you've all been muted on entry. I'll ask that you remain on mute to avoid background noise, but you are welcome to unmute yourself to ask questions. So this is not meant to be a one-way interaction. Please do ask questions if you've got them. So you're either welcome to unmute yourself to put them out there in the real world, or there is a chat function as well towards the bottom of your screen. So feel free to pop things in there. Ask me questions as we go. There is no reason to wait for questions. We will have an official Q&A section towards the end, but I find these things are often best tackled in the moment. So please do ask. I'm happy to answer from a best practice interviewing process, but we've also got some of your representatives as well who can answer more process questions and sort of how we got here questions as well. So we'll decide who's best to support your questions as we go through. Lastly, I'm going to launch some polls throughout today's session. So again, trying to keep this a little bit more engaging than just me talking at you at the end of a long day. When I launch a poll, a multiple choice question will appear and you're asked to submit a response. It's helping you really engage with the content and get the brains going at this time of the day. Keep in mind the responses that you'll see are anonymous. As a prelude for our session, I want to share with you some information which compares structured and unstructured interviews. An interview is an effective way of identifying somebody's suitability for a selection. However, there is a great deal of research to show that interviews can fall prey to pitfalls which result in poor decisions. On this slide, what you can see is a comparison between structured and unstructured interviews in terms of their effectiveness in predicting future performance. In making this comparison, many studies have found that structured interviews to be the superior method. And to be clear, when I say the word structured and unstructured interview, a structured interview is one like we're talking through today, where we're using the same questions, the same process, and a concrete rating criteria for all candidates. An unstructured interview is one where you ask questions stuff based on what you think you know about them, maybe from their CV or from prior knowledge, and everybody gets a slightly different experience. Not surprisingly then, the research found that looking at the different factors that can impact on the effectiveness of an interview, they found that two factors associated with the largest improvements. The first is training interviewers, and the second is structuring the interview and the subsequent evaluation process. With this in mind, our session today is intended to provide best practice guidance on how to conduct a structured and comprehensive competency-based interview, how to systematically evaluate and use information from a competency-based interview, and how to identify and overcome the obstacles to fair and objective assessment. Overall, the intent is to facilitate a fair, objective, and nationally consistent approach to the interview, helping you identify the most suitable applicants for the education and training program. Here's a brief overview of the interview process to get us started. The interview process is designed to enable the panel to evaluate an applicant's non-technical professional skills. Applicants will be interviewed at 3 separate panels, and each panel is 30 minutes. There will be 2 or 3 consultant plastic surgeons per panel, and each panel will consist of 4 competency-based interviews. All applicants will be asked the same 4 competency-based interview questions, and panels may ask follow-up or probing questions based on the applicant's responses. So let's turn our attention to how to conduct a competency-based interview. A competency-based interview is a structured series of questions aimed at eliciting information on specific job-related criteria. A key part of the definition here is a focus on job-related criteria In a competency-based interview, the information gathered from applicants is classified against competencies that are relevant and important for successful performance in a role. Each interview question is designed to measure one competency. The aim is to select surgical trainees who possess the attributes outlined in the college competencies, as listed in the first column of this table. These competencies have been aligned to behavioural competencies from SHL's Universal Competency Framework, a well-researched and validated model. What's important here is to emphasise that a competency-based interview is aimed at gathering evidence of job-relevant behaviours. To do this fairly, objectively, and consistently, interview panels must have common and consistent understanding of the essential competencies and what good performance looks like on these. The 2020 Interviewer Guide provides a definition of each of the behavioural competencies, and you're encouraged to ensure that you're familiar with them prior to interview. Here's an opportunity for you to test your understanding of the behavioural competencies. I'm going to launch a poll. Please select one option to, please select one answer to each question. Tara, can you please launch the first poll? There are 4 questions here, so please do scroll down and think about which competency is most important for each, or which of the following examples is representative of each competency. You can see some answers haven't come in yet, so please do keep answering. I'll wait until we've got to around 70% of you who actually responded. So we could be here for a long night if you've decided not to be the one who responds. Okay, so let's close down the polls and let's have a think about it. So the answers that we can see here, the first question is around the quality standards. It's all about quality patient care. That competency is all about understanding and focusing on patient needs and delivering high quality patient care. A part of this is using appropriate processes to ensure quality standards are achieved when delivering patient care. The second question about cooperation at all levels is all about collaboration. So you can see most people got that correct, fabulous. It's all about contributing to a harmonious team environment and supporting others. The third question is, as most of you found, all about accurate decisions under pressure. And the fourth was around using self-insights. I can see lots of it, 100% of you got that one correct. Fabulous to see. So don't forget to refer back to the 2020 Interviewer Guide for definitions of each of the behavioural competencies as we go through. All right, so if we move along to the competency-based interview, the competency-based interview will comprise of either behavioural questions or situational questions, or a combination of the two. Behavioural questions are focused on eliciting specific examples of past behaviour from applicants. For example, tell me about a recent occasion when you needed to quickly establish an effective relationship. What did you do? What was the outcome? Situational questions are predetermined hypothetical questions. Applicants are presented with a realistic, job-related scenario and asked how they would respond to or approach the situation. Their responses are evaluated against a set of predetermined criteria, as expressed by job matter experts. The situational questions are intended to gain an understanding of how an applicant's thought process and decision-making and how they're likely to use their experience, judgment, logic, and behaviours to address challenges. Conducting the interview starts with a strong introduction. The aim of the introduction is to, of course, set the scene, but also to put the applicant at ease. We want to get the best out of each applicant. To do this, you need to adopt an encouraging, supportive, and warm manner. A checklist for introducing the interview is provided in the interviewer guide. After the introduction, setting the scene, it's time to ask the questions. We recommend starting with an opening question to break the ice and let the applicant settle in. Then we move on to the competency questions in the interviewer guide, working through each in turn. You're listening for the response. Is it giving you valuable information related to what you're looking for? If not, redirect. Remember, your goal is to collect evidence related to the competencies being measured, so feel free to direct the applicant back onto the competency in question by using your probing and questioning skills. Questioning skills are key to the interview. During the interview, questions on the whole should consist of open questions, followed by probing questions until the interviewer has obtained specific information on a topic or subject. Without probing, you have little specific information on which to base your evaluation. For behavioural questions, the pattern of questioning should start with a broad, open question, then narrowing down to be more specific. We call this funneling. Following this example, which is on the slide, the first step is to open up about the competency with a nice open question to elicit an example. Tell me about a time when you... Then funnel down to the specifics, evaluating through probing. And this is where you as an interviewer, you'll start with that broad open question that's the same every time, but your probing will start to tailor based on what the candidate is saying. For example, so how did you go about doing whatever it is you've just described? What did you do about those problems? What was the outcome? Why did you do that? The selected behavioural interview questions have been created to include an open question, as well as some suggested probing questions to gather more specific evidence. While all applicants should be asked the same opening question, the probes are a guide. You don't need to ask all of the probing questions. You don't need to ask them all in that order if the applicant's response has already addressed these. Equally, you can use your own probing question, but there's only a need for the applicant to clarify or extend on their response. Consider whether you've understood what they're saying and whether you have enough detail to be able to evaluate their response. If not, consider using some additional probing questions. Here are some examples of probing questions which are designed for search for information in greater depth. Extending questions are often useful. For example, why was that? Clarifying questions are also good for eliciting more detail. You can see an example here. If the applicant said, I did have some problems in that job, we could ask, what sort of problems? And maybe they said in response, I'm good with people. We could ask, in what way do you mean they're good with people? Again, the intent is to get more information on which you can provide your evaluation, preventing you from needing to make assumptions or accidentally embellishing on the evidence they've provided. Some other examples of probing questions to keep in your toolkit are, can you tell me more about that? Tell me specifically what you did. In this particular probing question, it's useful for when you're asking for the behavioural questions to ask for examples of past behaviour. Sometimes applicants tend to describe exactly what they would do or what others did or what they might do next time, as opposed to what they specifically did. So saying something like, please tell me what you specifically did can be helpful. For the situational questions, you can also use probing questions to ask an applicant to expand on their response. Let's say in response to a scenario, an applicant said, I would ask the patient some questions. You can probe this by asking, tell me more about the questions you would ask the patient. You can also ask them to expand on their rationale for adopting a particular approach. There are some questions we should aim to avoid during an interview. These are closed questions, and a closed question is one that can only elicit a yes or no response. That's hard to evaluate. Closed questions are used occasionally when you're trying to clarify certain points with applicants. For example, were there 5 of you in the team? Leading questions are great to avoid. I expect you enjoyed that. Candidates find that very difficult to say, no, I hated doing that. Leading questions encourage the applicant to respond in a particular way. Multiple choice questions limit the way an applicant can actually respond. So, did you leave because of the pay or because you were bored? There might have been other reasons they left. We could simply say, why did you leave? Double questions are where you ask one, followed by another, sometimes followed by another question. Applicants get confused and usually can only respond to one question at a time. Put one question out and then follow up with your next. There are other questions to avoid that are actually unlawful. It's against the law to discriminate against someone because of a protected characteristic. You cannot make selection decisions based on these protected characteristics, and you should be cautious about asking questions about any of these. Australian states and territory legislations do have some differences. However, some examples of protected characteristics include race, skin colour, religion, political opinion, age, sexual orientation, domestic, marital or relationship status, pregnancy or potential pregnancy. All topics to avoid entirely during the conversation. So again, I'm going to launch a poll now and thinking about which of these sample follow-up questions you should avoid to probe in an applicant's response. And I'm going to ask you to select all that apply. So there is more than one correct response this time. Which ones are we avoiding? Give you all just another moment. All right, we've got most of you done, so give it 30 seconds and then I'll move along. All right, so we'll close that down now. So the two responses that we needed to avoid, so you must have sought advice from others before making the decision. Who did you go for advice? A great example of the leading question. Well done for identifying that one was to be avoided. Did you consult with others to determine the best way forward? Yep, that's another great one to avoid. So good to see that a majority avoided that one. That's a closed question and potentially leading as well. So both of those could be reframed as, who did you go for advice? Fabulous. All right. So here, really thinking about rephrasing the question. And here, if this is the question that we had, did you consult with others to determine the best way forward? What I'd like this group to do is really thinking about, what would you actually ask that question as? Feel free to chat it into me, or if you're feeling very confident and want to show everybody, you can also annotate directly on the screen. If you're not confident in sharing, just think about how would you ask that question in a more open way? How did you move forward? Fabulous. Yeah, that's a really great way of asking that question. So how did you move forward? How did you determine the best way forward? Another question for the group to think about how you would reframe to be more positive. You must have sought advice from others before making the decision. Who did you go for advice? Any thoughts? This one I would reframe as, what inputs did you use to make the decision? So instead of assuming they had sought advice, opening it up, asking how they came to that decision. What inputs did you use to make a decision? Always thinking about these questions, it's really easy to put our own assumptions into questions as we go through, but a really great interviewer pulls himself back and asks really great, concise, open questions. It's not a skill we often practice, but a good one to get in the habit of. So at this point, I'm going to turn from actually conducting the interview, and the interviewer guide gives you lots of great advice and support to do a great interview. So follow that guide is my strongest advice yet. Looking at the second half is all about assessing the applicant. Once you've conducted the interview, it's time to assess them. We'll finish the session today by covering the best practice approach to evaluating applicant responses. The effectiveness of an interview is largely dependent on the skill of the interviewer in gathering effective data through probing and questioning and objectively evaluating this data. When evaluating applicants, we should be aware of our cognitive biases, which can affect the decisions and judgments we make. As humans, we rely on some mental shortcuts that allow us to act quickly and process the information around us. This means that our brains can sometimes reweave the tapestry of our experience, creating errors in our thinking or our memory. Our cognitive or unconscious biases can create errors when interviewing and evaluating applicants' responses. Some examples of unconscious bias that you can see up on the screen, and they include the halo or horns effect. So if the applicant starts off well, then everything else they say seems positive, evidence for which reinforces that initial impression. The opposite would be the horns effect. If the first thing they said was a bit silly, you're going to assume that that's true for everything else. The idiosyncratic rater effect suggests that we tend to like people and rate more favourably applicants who are like ourselves. We find it hard not to assume that people who are like us would behave in the same way we do, and be as successful as we have been. We find it hard not to assume the way we would respond to a question and embellish those answers and think through what they would add. So we add ourselves into their story, particularly when we don't have enough detail to actually rate the response. This is where actually going further, probing more to get specific evidence can help keep you out of that effect. The confirmation bias is the tendency to explicitly favour, search for and remember information that confirms a usually shallow belief or hypothesis that we already have. As a result, interviewers ignore or forget details that conflict with that belief. The availability heuristic is the tendency to overestimate the importance of information that's easy to remember. So those really standout things that are either brilliant or terrible, but they really stand out, they're easy to remember. And that's why it's important to take detailed notes throughout the interview. This is particularly important for roles like this, where a lot of people have quite similar experiences, and you may start to feel like you're hearing a lot of the same thing. So the standouts really do stand out. Taking great notes is one of the best ways to manage that error. The effective heuristic bias occurs when judgment is influenced by a particular superficial trait, such as race, gender, the clothes someone's wearing, the background or names that they're using, even if the individual is perceived as being attractive or not. We like things that we like, and that creates a halo effect around it. The anchoring bias is the tendency to compare applicants to others before having a look at the evidence. It's important to focus on the evidence gathered on its own merits. You are not comparing candidates to each other, you're comparing candidates to a standard criteria of behaviours. You should assess each individual applicant at the end of their interview, rather than assessing all applicants at the end by anchoring against each other. He was better than she was better than he. It's an unhelpful anchor. So do make sure you're at the end of each interview, writing your notes, rating, before moving on to the next person. The approach described in this section covers the key steps in a behavioural evaluation and can be remembered by the acronym ORS. This stands for Observation, Recording, Classification and Evaluation. This is a structured behavioural assessment model that enables us to objectively assess behaviour against a competency framework. The ORS methodology is a discipline for reducing bias. The first two stages, observing and recording, occur during the interview, while the second two stages, classifying and evaluating, occur immediately after the interview. Observing requires that you pay attention to what the applicant says and does. This, of course, requires attention throughout the whole interview. Note-taking helps us pay attention. It's also critical for evaluating the applicant post-interview. The key is to take note of the actual behaviours and observations and capture short descriptive quotes rather than by simply writing judgments. So it's important to be actually writing what they're saying, not how you feel about what they're saying. This will help in discussing and integrating your observations with other panel members. As an example, suppose that you noted the applicant seems like they wouldn't cope well with pressure. How would you justify this observation if another panel member disagreed with you? What evidence do you have to support it? Excuse me. Having established a good record of observed behaviours, the next stage is to classify them appropriately against the competencies used in the assessor rating form, which you'll sometimes hear referred to as an ARF. This happens after the interview. Assessor rating forms list the positive and negative indicators for each of the competencies. An example is provided here. The competency to be assessed is coping with pressures and setbacks, and there's a list of favourable indicators and unfavourable indicators for the competencies. These are designed to help you as an assessor to classify and evaluate your notes. The indicators are provided not to be exhaustive, not to assume that all candidates will touch every moment. You may find other suitable evidence in your notes which is not covered by the indicators. That evidence should still be included and reflected in the overall rating for which you give each competency, but only when it's relevant for the competency being assessed. After you've evaluated an applicant's response, discuss your evidence with the panel and in collaboration, provide a rating for each competency. Remember, this should be done at the end of each individual applicant interview, and you need to use the 1 to 5 point rating scale you see described here. When using this 1 to 5 rating scale, you'll need to consider the amount of favourable and unfavourable indicators exhibited and the significance of these behaviours. 1 is used for poor or well below acceptable response. This is used where the applicant has shown significant weakness across most of the competency definition. Essentially, they have exhibited none or very little of the competency definition, or that they've shown significantly unfavourable behaviours across most of the competency. For a rating of 2 or marginal, the applicant may have shown some small strength in some areas, but they may have some significant weaknesses in other areas and some small weaknesses in others. This means that the difference between a 1 and a 2 is the significance of the weaknesses observed. As an example, evidence of rude behaviour may be considered of some weakness, but not as important as evidence of racist behaviour. To be rated below 3, the applicant must be below the level expected of a surgical trainee at the time of appointment. This is really important. A 3 is used when there are some marked strengths and some weaknesses that are limited to specific areas. The weaknesses should not be significant, and a 3 would indicate that the response or evidence is consistent with the level of appointment. We would expect a standard applicant to be seeing a 3 at the level of appointment. A rating of 4 is used for evidence or responses that are better than expected for the level of appointment. In particular, the applicant's behaviour is consistent with the level of appointment on some aspects, but above the level of expectation in other areas. 5 indicates an excellent response, where the applicant shows marked strengths on most of the competency. A 5 or an excellent response would signify that the response or evidence is well above the level of appointment. For example, it would be what you'd expect of a qualified surgeon to be providing that type of responses or demonstrating these types of behaviours. A 5 should really differentiate your exceptional candidates, and therefore it is expected a rating of 5 would be an exception rather than a rule. When you have agreed on a rating for the competency, complete the evidence sections of the final assessment summary sheet. And there's 1 sheet per applicant to justify your rating and add in other comments that help support your evaluation. You can keep the scales analogy in mind when deciding on a rating. Remember, we're weighing up the amount of favourable and unfavourable indicators observed, but also their significance. A degree of judgment is required for the assessor. Some unfavourable or favourable behaviours may be much more significant than others and carry much more weight. So the weighing up process is not a simple matter of counting up the positives and negative indicators. You also need to take into account their relative significance. At this point, we are trusting your judgment as professionals who understand the relative importance of the different behaviours that you see every day. So we're going to do an exercise now to give you an opportunity to practice and discuss how you differentiate an excellent and good response. You'll see that Tara has just put into the chat box a worksheet. I'm going to ask everyone to download and or open that worksheet that has been shared in the chat function. The groups, I'm curious to hear from this group, how easy or hard was that? Anyone willing to explain how they went in their activity?
This is Justine. Our group did discuss that this is a fairly difficult question for an unaccredited trainee or even for an accredited trainee actually, because this is a political hotspot that they really just need to know the lines of escalation and the evidence for training and techniques to determine whether or not someone is actually competent to do an operation and whether or not it could affect patient care.
Mm-hmm. So was it easy to differentiate an excellent response from a good response?
I think in this scenario, it would be quite difficult to determine an excellent from a good.
Mm-hmm. Yeah. And these are realistic scenarios. So I haven't made this up separately. This is a part of what we're doing. So it is thinking about what makes something excellent, what would make something good, what would make something acceptable for a starter trainee. So at the point of, I've just lost the word I'm going for there, at the point of appointment, that level of trainee, what would be acceptable, because that's your three. That's your three. It's always important to think about when answering these questions, when you get okay, I know what acceptable for a trainee would be. The next step is, okay, if I'm inclined to give this person a 4, why not 5? What else would they need to be telling me to say a 5? And if all you're saying to yourself is, I don't know, I just don't kind of like using 5s, then give them the 5. Because if there's no good thing that they're really missing, they probably are giving you that excellent response, and we should be bumping them up. So if not, why aren't we using the ends? Many people sort of tend to want to hang around at the 4, and at the bottom end also. I'll use the 2 because giving people a 1, that seems quite harsh. I don't want to be harsh. Making sure that you can actually bump there is quite valuable. All right, so conscious we've got 10 minutes to go. I will crack on and move through. I'm going to turn myself back off camera because you've all seen my beautiful face at 8:20 in the evening. So feel free to keep yourselves on if that works for you. But otherwise, let's just think about, in addition to the behavioural competency-based interview questions, the interview also provides you an opportunity to directly observe and assess the applicant's communication skill. If you've been assigned to assess the communication competency, and note that not all panels will be assigned to assess this competency, you will have direct evidence of their communication skill, which you can take into account when assigning the rating. So take note of how the applicant built credibility with you and with the other panel members, how they attempted to build rapport, the clarity with which they expressed him or herself, and how well they listened to and answered the interview questions from a communication perspective. The nature of these behaviours can be evaluated using the same 1 to 5 rating against the communication competency. And again, you can see the indicators up on screen today. One real trap I find with the communication competency is I'm asking you only to assess this if you have been assigned to assess communication. A candidate who has great behavioural skills but poor communication can be marked down throughout because of the communication. So being able to differentiate how they said it from what they said is the real trick of the behavioural questions, but the communication competency is really critical when you're being asked to assess that. So just always keep in mind, what am I assessing? Is it their communication or is it something else? And don't allow the communication to always cloud the behaviour. Greg, you've raised your hand. Would you like to add something there? May need to take yourself off mute. Greg? All right, I will assume Greg will say what he's going to say later. Not sure what's happened there. So as we come right to the end, some final tips on evaluating an applicant's responses. Write up your notes immediately while the evidence is still fresh. Capture quotes and real life examples while the evidence is still, to help you decide your ratings. In collaboration with the panel, discuss your evidence against the competency and complete the evidence sections of the final assessment summary sheet. Evaluate whether the behaviours shown are favourable or unfavourable using the indicators of the competency definition and the significance of these behaviours. At this point, a rating can be applied to represent the overall evaluation of performance against each competency. Keep in mind the biases and sources of error we covered earlier. Take notes during the interview and to avoid selective filtering, and base your decisions on evidence linked on the job requirements. Think about how you want to take notes. Are you somebody who likes writing on a piece of paper? Very much enjoys using a laptop writing your notes. If it is a laptop, think about how you position the screen in terms of how much openness or closedness it gives to the candidate. Someone who comfortable being able to use a pad to write your notes. It doesn't actually matter how you write your notes. Use what's most comfortable for you, but also make sure you're thinking about how you open up and create warmth to each and every candidate that comes along. So just think about that before you come along. A final note on resources and materials to support you with the interview process, and these will be shared with you. So don't forget to take to the interview the competency definitions, the interview questions, which have the list of favourable and unfavourable indicators for each, the notes taking sheet, and the final assessment sheet to fill in your rating for each applicant. Other resources to support you, which you don't necessarily need to take to the interview itself, are the course notes, the interview guide, and there's also a one-pager on how to run a competency-based interview. So at this point, I will open up to questions. We've got around 5 minutes left, so happy to answer questions. And if I'm not best placed to answer them, I'm sure Greg or someone else will chime in with their answers as well. And Greg has shared on the chat that his mic is failing. Communication is assessed at every interview as a global competency, but there may be an additional communication question in addition to the global assessment. And Greg's going to provide all that material I've just described following this session. So at this point, feel free to take yourself off mute if that's your preferred method, or pop a question in chat if you've got any. I shall take deafening silence. Oh, there has been a question. Oh, got some commentary. Kirsty, which other surgical specialties we work with? There's 3 or 4 of them. I'm struggling to think of them off the top of my head right now, Kirsty, but I know there are, 3 or 4 of them and a few others in the past. I'd have to come back and check on that before I could actually answer with any confidence, Kirsty. With that, I'll take the deafening silence on content-related questions to say that you've understood everything and are comfortable with an interview process. So thank you all for this evening. I've had a lot of fun. I hope you've all learned something valuable for your process coming up. So best of luck with that, and enjoy interviewing. It's always best on the other side. Have a good evening all.